Working. Oh, there it goes.
There we go.
Okay.
Okay, great. Thank you. Thank you, Cynthia, and welcome everybody. We have quite a crowd here today, and we really appreciate that. Welcome to HCP's Emergency Management Webinar for New York City home care providers. Today, we're going to focus on supporting your staff. They are a big part of what you do, the glue that holds your business together, and supporting them is super important, especially in a crisis situation. And it just so happens that tomorrow, May 1st, starts Mental Health Awareness Month. So we'll just ask you during and after this webinar to reflect on the well-being of your workforce. So many recent statistics reveal that employees across all industries, especially in healthcare, as you know, are more susceptible now to stress, burnout, and depression than they were before we had our pandemic situation. So just keep that in mind, and thank you for wanting to support your staff and be with us here today. So we are HCP, the New York State Association of Healthcare Providers. We represent the home care industry. Our foundation is responsible for most of our educational events, and they are the grant recipient that we are working with today. Our president and CEO is Kathy Fabreo. Laura Eric, Vice President of Public Policy, is here with me today. I am Carol Dio, Senior Associate of Public Policy, and helping us out is Cynthia Pritchard and Dina Collins with our technology and our Zooming. So what are we up to today? We're going to do just a couple of introductions. We already started that. We'll do housekeeping notes really quick because I know everybody's used to Zoom by now. And then we are going to hear from some esteemed colleagues. I'm so excited to have these speakers with us today. We have a team from VNS Health to talk about an important research project that they did. And then we also have a life coach from Center for C to talk to us about how to better support your staff. We are hoping to leave a few minutes at the end for questions. And unless it's something very pressing, pertinent to a slide, we will take questions at the end so that we can keep things moving along. And then, of course, we'll have our evaluation that we'll ask you to fill out. So we have our partners here today. As I mentioned, everybody from HCP. Fidel Monroe from New York City Department of Health and Mental Hygiene is also with us today. She's the Senior Program Manager for Long-Term Care, Bureau of Healthcare and Community Readiness of the Office of Emergency Preparedness and Response at New York City DOHMH. And she gives us such great support with these projects that we are doing under a grant. I don't know if there's anyone here from New York State, but shout out to those folks. We often have somebody from the Hudson Valley or our colleagues in Albany come and support us. And then other partners, we have a couple of other associations registered to attend today, and we thank them for attending and for supporting our efforts. My clicker's not working very well. So I just have to tell you that this project is supported by the Department of Health and Human Services Administration for Strategic Preparedness and Response. We call them ASPR under this award number, and want to remind you that the content is solely our responsibility and does not necessarily reflect the views of ASPR or the New York City Department of Health and Mental Hygiene. A couple of housekeeping things: you can dial in or use your computer audio. Computer audio sometimes is impacted by your internet connection, so keep that in mind. We have muted all participants to avoid background noise, but please, please put your questions in the chat at any time. We have at least 2 of us at all times monitoring that so we can make sure we get to questions. Some things that we may not be able to get to today, we will try to follow up in our post-webinar email to you. Please don't use the direct message feature because those messages are often missed. We also cannot retain those after the close of the webinar. So if you direct message one of the speakers, it is very likely they will not get that. You will receive all slides after the presentation as well as the recording. And today we are going to have some interactive polls. So I'll ask you to grab your smartphone or open a browser. We are using an app called Poll Everywhere. And once we get to those questions, when the poll is active, you can respond at the website listed. It's pollev.com/CarolDio549. Or you can use your phone to text the number 2233, and the message you're going to send is Carol Dio 549. So you can go ahead and get that started up right now. Just let you know you do not have to put your name in those. They can be completely anonymous. So you do not need your name in there to participate. So here's our first poll question already. We want to know, do you provide home care in the 5 boroughs? That'll be a yes, A for yes, B for no, or C, you're not a home care provider. Give it just about 30 to 45 seconds for folks to punch in. So far, everybody, yes. While we gear this webinar towards New York City providers, we do invite other folks to participate. We have a couple of non-providers. There's just going to be 3 of these questions, so it helps us to get to know who's out there and what you need from us. Okay, great. So over 80% of our participants do serve New York City. That's fantastic. So now it is my pleasure to introduce the team from VNS Health. We have Margaret McDonald. She is the Associate Vice President of the Center for Home Care Policy and Research at VNS Health. Margaret is responsible for research studies of the home health sector, including patient interventions and outcomes. Since joining the VNS Health Research Center in 1998, Ms. McDonald has been a project director and co-investigator on a number of large projects for the Agency for Healthcare Research and Quality. You may know them as AHRQ, the National Institutes of Health, NIH, and other foundation-supported projects. Margaret is a graduate of New York University's Stern School of Business, and she received a master's degree in social work with a concentration in research from Fordham University, and she has co-authored over 100 peer-reviewed articles. Joining her today from her team is Amanda Weiner. Amanda is the Director of Organizational Development, Learning and Development at VNS Health. As a leadership coach and organizational development professional, she helps all employees at all levels find their potential and achieve their goals. Her focus on diversity and inclusion lends success to projects at VNS involving change management, employee management, and so much more. Along with several coaching certifications, Amanda holds an MA in Social Organizational Psychology from Teachers College and a BSM from Tulane University's A.B. Freeman School of Business. Last but certainly not least, Rosa Marcus is VNS Director of Support Services, guiding home health aides and providing them the tools to excel in their jobs. She oversees the compliance, verification, and Chinese units, helping staff to find their potential, as well as working with outside vendors to maximize the use of technology for the personal care teams. Under her leadership, VNS has achieved a 97% participation rate for home health aid technology. Rosa has been with VNS for over 40 years in a variety of roles and is a graduate of Bronx Community College. And now I'm going to turn it over to them and help them out with their slides. So here is our list of presenters.
All right, Carol. Yep. So you did a great introduction, so I could bypass that. Thank you so much. Good afternoon, everybody. As Carol said, I'm Margaret McDonald. Got my introductions there. So I'm going to tell you a little bit about the VNS Health Organization, put it in context of some of the things that we're going to talk about. So we offer a variety of provider services, direct care services, as well as health plans. As you can see from this slide, VNS Health is the largest home health agency, as well as the largest hospice in New York State. We offer behavioral health programs and care management services. And then we also have a large personal care division that will be a large focus of the presentation that we are talking about today. In the health plans, we also have a variety of options, including some long-term care programs, Medicare Advantage, and special needs programs. Across these programs and plans, our daily patient and member census is almost 50,000. So just a little bit about who we are. So we have a few objectives for our presentation today. I am going to start off talking about a study that we conducted during COVID. And specifically, I'm going to review findings on factors that helped the home care workers, home health aides feel prepared to work during the pandemic, and separately, factors that were related to workers continuing to be available to take on home care visits and serve patients during this time frame. I'm going to quickly review some materials that were generated from this work and some other work we did at the time that are available to all that hopefully might be able to help in additional pandemic and crisis planning. And these materials are specifically targeted and related to Elixir services. And then I'm going to pass it along to my colleagues, Amanda and Rosa, who are going to describe the evolution of a virtual phone-based support program that VNS Health initiated during the pandemic. So to start off with the research study, I'm going to share findings. This is a survey that we conducted 6 months, so early in the pandemic, 6 months into it, August and September of 2020. And the survey itself covered a lot of topics, including asking people about their own personal well-being, feelings about risk and safety, and opinions about organizational communication and organizational response and support. We had a little over 1,300 home care workers completing the survey. And as I mentioned a little while, there was a lot of data that came from this study itself. But today we're going to specifically focus on just some analytic outcomes that were related to, again, feeling of being prepared and characteristics that were related to people staying continuously available, and how what's associated in relation to personal, organizational, and work-related characteristics to these outcomes. The citation at the bottom, that's okay, Carol, you don't have to go back. Citation at the bottom, which will be in the slide deck so you can see the full presentation, because with my time, I'm going to go over the findings pretty quickly. So this is the multivariate analysis that we have, meaning that these are the findings that really stand out, that are statistically significant after taking into account a variety of characteristics, personal characteristics like age, race, location, opinions about other organizational and workplace factors. So these are the things that stood out from there. So when you see something that's above the 1 line, that means that it was significantly positively related to somebody feeling prepared. If it's the red boxes below, that means that you were, it's less likely that you were feel prepared if you also had these characteristics. So the first set are somewhat to be expected. Those who feel that their employer actually trained them for the possibility of working during the public, and those that reported that they knew that they might be asked to respond in a public health emergency, were more likely than to be prepared when the emergency happened. And also the people, going back to haven't quite finished that one, Carol, but in that group, also the people who reported that they felt that their employer provided them with adequate PPE for themselves and their clients. Again, they felt more prepared. So things that you might be, expect. Other organizational characteristics that were associated with people feeling prepared were those who felt they're satisfied with the employer communication during COVID-19, and they also felt that they reported that their supervisor provided them clear instructions. Those who were less likely to feel prepared were also those who had moderate to severe mental distress. Now, we can't say what the direction is. This is an association, so we don't know if they felt less prepared that caused them distress, or the distress actually undermined their feelings of preparedness, but we do know that there was an association. In this worker availability, so this is again for people who said that they were continuing to accept cases throughout the first 6 months, so major part of the crisis, these are some of the variables that were associated with that outcome. I'm going to highlight these because we have some other factors that came into play here in our findings. And this was, so if the greater number of people that you had in your household, the less likely that you were continuously being, able to be available. We don't know behind, whether there were people at risk at home, so the worker decided they couldn't work as much because they didn't want to bring the risk at home, or there might be a COVID event that they had to call in sick and they couldn't be available. So we don't know, but we do know that, again, associated with the number of people in the household. And similar to our other side, those who were experiencing moderate to severe mental distress were less likely to be able to continually take on cases during this time frame. And this next one here is those who did report for themselves that they had very good and excellent health were more likely to continue to be available. And again, it's the risk benefit, the risk balance that the individual aides might take on as they're thinking about whether they could take on the work. And similar to the findings that we showed on the other slide, those who were satisfied, extremely satisfied with employer communication were more likely to be available continuously, and as well as those who believe that their supervisor provided clear instructions. So here is just a summary of the implications for policy and practice. If you want to help the home care workforce feel more prepared for an emergency and to ensure appropriate and adequate staffing levels, organizations should provide some crisis-specific training before an actual crisis. Of course, adequate PPE for an infectious disease-related crisis is imperative. But in addition to this, making good communication and emotional support services a priority will help the situation. And so this is some evidence that can drive organizational decision-making about program planning. And actually, it's going to lead to the rest of the presentation as my colleagues talk about actual strategies that were put in place to try to tackle both of these issues. Actually, but before I hand it off, I'm going to tell you about a resource that we have available to all. So in addition to the home health aid survey that I had described, we conducted more in-depth interviews with other home health aides and LICSA leaders, union and government representatives. We were trying to, at that time, and actually it was most of this work was done in 2021, to reflections and capturing on information on actual pandemic experiences and lessons learned to try to find out what worked for different people. We did compile it into this workbook and then convene stakeholder meetings to review and come up with some sort of roadmap for additional pandemic planning. So this is available to all. And then what resulted into it are these action plans that we have 5 different action plans in total. There are commonalities across these are checklists for things that people could do. So there's one for the provider. So for the home care provider organizations themselves, there's one for unions and associations, things to work on. But then there's each at a local, state, and federal level that we all could use for advocacy purposes, because we do know that there's still some advocacy to do in this area to be able to support this workforce. And a connection for these in your slide packet will be a connection where you could link these. These are publicly available. So now I'm going to hand it over to my colleagues, Amanda and Rosa.
All right. Thanks, Margaret. Everyone can hear me okay?
Yep.
Yeah. Okay, great. Okay. So I'm Amanda Weiner. You heard my bio, but I work in HR. I do employee engagement, employee listening, leadership development. So that's how I came to be involved in this project and why I continue to be so. In the next 12 or 13 minutes, you're going to hear from me and from my partner, Rosa Marcus. Rosa and I knew each other before the pandemic, but through this project, we've really become very close, and I'm very pleased to be on this journey with her. So you'll hear from both of us in the next few minutes. So bringing us all back in our minds to March, April 2020, I'm sure that brings up visceral feelings for all of us. We were, as an organization, we're a very large organization, as Margaret showed. Just to connect some dots, in case you don't know, at that point, we were called Visiting Nurse Service of New York. We've been around since 1893. We did rebrand in 2022. So if you see any references to VNSNY, or if that name rings a bell, we're the same organization. At that point, our home health aides who now sit in a division called personal care, and that's where Rosa works. That was Partners in Care at the time. So if those names ring a bell, that's why. So for my role in HR at the time, we were just trying to figure out how to best support our employees across the organization. And we were doing this with a lot of employee groups, not just home health aides, but we started these support groups. Some were facilitated by our EAP, some were facilitated internally. So we wanted to create a forum for our aides to be in touch with each other and with the organization. So I reached out to a social worker who I didn't really know in hospice. He had been doing this internally within his own department. He is a therapist with a thriving practice outside of the organization. So he has a ton of over 20 years experience leading support groups. And I said, Ben, my name's Amanda. Are you willing to give this a shot? And he said, absolutely, let's do it. So we had no roadmap. We did not know exactly where we were going, what we were going to do. We just wanted to get started and offer support. So April 22nd, that was our first call. Over 160 people joined that call. I was on it. Ben was on it. Rosa was on it. We had no way to communicate with each other during the call. We had not yet figured out any systems, but we knew from that very first call that we were on to something big. There was a lot of energy. It was chaos. At the end, you can see a quote I wrote midway through the slide. Ben said on that call today, I'll never forget it. He said, beginnings are hard, but we're going to figure this out. And we certainly have. So Rosa and I are going to explain how and what we figured out. Ben's approach, I'm not going to go into all the details, but just so you have a sense, and I am reading my notes here because I don't want to mess it up. Ben's approach to leading groups is that all feelings are welcome. He said, these are his notes from back then, that in a time when many answers are unavailable, acknowledgement is always available. He mentioned that caregiving work under normal circumstances is demanding and stress-inducing, so even more so during this global pandemic. He mentioned that staff deserve appreciation and understanding for the great efforts that they're making in dealing with patients, et cetera. So that's just some of the framework that we brought into these calls and continue to this day. It was a real team effort. I listed some of the teams involved: operations, the communications team, our facilitator. I said I work in HR. We had a nurse sitting in on every call from what we called the CERT team to help with clinical questions. Obviously, we had a lot of COVID-specific questions at the time. I'll explain how we fed back information to our leadership team, our IT department. So it was a big group effort. On the next slide, and that's a real, you don't have to go back, but that was Ben, our facilitator, the picture. And that was not our original invite, but that was our invite from early on. I found it in my inbox. This is an analysis that one of my colleagues in HR did. So I had taken notes during every call. I never took people's names. The calls were very anonymous unless people wanted to share, but they used first names so that we knew who we were talking to, but that was it. It was a Verizon conference line. We did not see each other. But I was taking notes because I wanted to do something with the content, right? So at the end of every week, I would put the notes together and share them out with our leadership to know what are the themes. So I had an intern of mine actually put together this analysis of our first year of calls. You can see there were a lot of topics. As Ben said, all feelings were welcome. So you can see some of the things we talked about on this slide. I'll call out, if you're wondering what we mean by positive feedback, that was feedback around, thank you for these calls. Thank you for the PPE I got. Thank you for the support. Thank you for helping me. Obviously, there was talk of vaccines, of operational questions, obviously a lot of talk about COVID. So I like to say that these calls are like a microcosm for what's going on in the world. And these calls, whatever's going on in the world tends to find its way into our calls. On the next slide, I want to just call out, and I can paste the link into the chat when I'm done chatting, which is just that in the summer of 2020, totally independent of us, there's a woman named Dr. Emma Swee. She works at CUNY. She's a researcher in this field. Maybe some of you know her. She was doing her own research to see how organizations have been supporting home health aides. She talked to a lot of people from a variety of agencies, but when she talked to our home health aides, enough of them mentioned these calls, which was very flattering, that Emma eventually found her way to us. And through a series of interviews and analysis of my notes, Emma and her colleagues published this study about what they found, what were the outcomes of our calls, which were very positive. So on the next slide, this is one of Emma's slides. She shared it with me. She knows that we're doing this here today. This was some of their findings that they found in analyzing our data. It was just that multi-directional communication was generated, meaning we got information from the home health aides and they got information from us. So it was really mutually beneficial all around. And in a few minutes, Rose is going to talk to you much more about the outcomes of our calls. So I'll leave it here for now. On the next slide, you can see an example circled in red, May 8th, 2020. This is an actual email that I wrote. So I used to write these emails every Friday. I would pull it together and say, this is what happened in the calls. This is how many people came this week. These were any challenges, any process changes we made. This is who joined us, you know, from a leadership perspective. And then what are the themes? So I know it's very small, but in purple, I guess I had highlighted this to call it out. I sent this to many people across the organization. And then I know Rose always sent it on to the home health aide supervisors as well. You know, I just called out that we had heard a lot of appreciation this week. And those were some of the quotes. I liked to include actual quotes whenever possible, because this was a way of connecting our agency leadership to the actual experience of the home health aides, which was obviously at that time very intense. I no longer take these notes. That became just less necessary as time went on. We do take we make notes in terms of just what follow-up items need to happen, but I don't take notes the way that we did then. Okay, so I'm going to pass it to Rosa, who's going to catch you up. I caught you up on sort of the early time, but now Rosa's going to tell you how has it evolved and what are we doing now?
Hi, like Amanda introduced me. I'm Rosa Marcus. I'm Director of Support Services. I have been with this organization for over 40 years, and it's been a journey. I love the job that I do. I have many different positions in the organization, but what I'm doing today is what I really like doing. I work very closely with home health aide supervisors, with the whole operation and how we work closely with the home health aides, and I support everyone as much as I can. During the pandemic, this was, wow. Like Amanda said, there was a real shocking to all of us. And we managed to get these phone calls and talk to our home health aides. And it was such a good feeling being able to be there for them. When we started, we had until today, we've had approximately 297 calls. But in the first year, which we started in April, we managed to get to handle 78 phone calls. In 2021, we handled 94 phone calls, as we stated here. And then in 2022, that's when we started to decrease to 2 calls, and the volume was lower, but the intensity of the calls continued to be the same. You know, staff were just so overwhelmed and so happy to have us there. You know, we caught on to what was going on and all the changes in the industry, how the world and the needs of the changes were continuing to happen. Then in 2023, we handled 45 phone calls. At that point, we had decreased to 1 call a week. And it was hard for us to do this. It was interesting when we decided to go down to 1, because we were so used to doing this every week. Amanda and I, this just became part of our daily, of our weekly routine. And it was hard to make a final decision to bring it to once a week. And we are not leaving that. We have no intentions of stopping these calls for now, because we feel that we just continue to engage with them and assist them in everything that we can. In 2024, so far, we've handled 13 calls. And again, they continue to be very helpful. Overall, you know, we have spoken to, or we've had about 11,000 plus callers in our overall, but on an average, we're averaging like 35 calls per call, 35 callers per call. We've actually made some changes. It used to always be daytime calls. It was always 1 o'clock in the afternoon, but now we have added an evening call, because that also grabs a different type of aides that are available to join us in the evenings. But interestingly enough, those that come during the day still come in the evenings. It's become a habit to them, just like us.
Rosa, I don't want to interrupt you, but I want to make sure we get to discuss the outcomes. I'm just keeping an eye on time, and I know you have a lot to say about the benefits of all this program.
Right. Yes. Let's go to the next slide then. Let's go to the next slide.
Thanks.
How can I describe it? We have, give me a second, I just lost my screen. For the home health days, this has been such an emotional support. They, they came to us with different topics, different concerns, besides having someone there for us, they needed someone to hear them. They needed someone to hear them. And Ben Serlin, who was our social worker, he was so good with them. He interacted with them. He was there to listen to them, to offer them support. They were at a situation where they were running out of supplies. We were trying to figure out how to get the supplies to them quickly. We continued to listen, give them the support, offer them help, give them access to different ways. And what we did during that process, we developed a website. During these phone calls, it became known that they needed something quick for them to be able to get access for information. And calling, the volume of phone calls were so high that it was difficult for them to get us. We developed the Home Health Day website for them. So everything they needed, they would go to that website. They will order supplies from the website so they would get them quickly. If they needed to send us a message, we had an email group that they would send a message to, and we would quickly get back to them. During the phone calls, we also had two nurses that were always there in the beginning. And if there was a nursing question, they were able to respond to that question right away. And they left those phone calls feeling like they were really supported. Whether it was Ben giving them the support, whether it was the nurse telling them what to do in a certain situation, or Amanda and myself giving them the operation support, it was just very overwhelming, and they was really appreciated, which is what led us to continue to do that. We took that website and we have until now developed such a strong website that any calls, any questions that they have, not only were they able to get answers on our call, but they were able to go into the website as a result of that and get what they needed. And to me, that's my Bible now. I'm sorry.
Is that the one on the next slide? I was just going to ask you.
Yep,
so
we
the
have a
folks can
screenshot
see.
on.
Yeah. Yeah.
Yeah, that's the next slide. And this is the screenshot this is where they go. They're able, they need a phone number, they go here. They need to quickly order supplies, they go there. They need to learn how to download an app, because we do use different apps for what their role is in clocking in and out from the patient's home. The information is here. And this is our Bible now. And this also led to a Home Health Day newsletter that we provide every week with updates. So as they get these updates, then they go into the website and get details.
That's great. That is really cool.
If I can jump in for 1 sec, I want to call out two things. Number
we're
one is
going to
that
have to move on to the next speaker in about 2 minutes too.
Perfect.
So.
No, that's fine. We can wrap up. We can absolutely wrap up after this.
Thanks.
Was just that number one, our aides didn't have access. They don't have VNS Health computers or laptops, so they didn't have access to our intranet. So this might seem really obvious, like, yeah, you post stuff online and people can see it. This was a challenge. We had to come up with what's the best way to communicate with them. So that's why we built this external site. Any of you can go visit today. And then the second thing I want to call out about the site is that it was actually a suggestion from an aide on the call. So that's pretty cool. If you go to the next slide, here's just some screenshots of the email reminders. So we email to their personal email addresses and we send text messages. So that's all we wanted to show you here. And then finally, Rosa will share with you in the last 1 minute. You can pick out a few, Rosa. This has not been easy. This has not been perfect. There are a ton of challenges. So we don't want you to think like, oh, easy breezy. But we did figure it out. And I think the idea of us being here today is that for some of you, like maybe this will inspire you to do it as well in your own organization. So I don't know. Rosa, you want to pick like 1 or 2 challenges?
Languages.
Or we could stop. Yeah, languages.
Yes.
No, that's okay.
It's okay.
Just one more minute.
I can make up the time. So go ahead. Finish up.
Languages, although our population is highly English speaking, we do have tons of home health days that speak different languages. So they were not able to join our phone calls unless they were understood English clearly, but we were able to come in, like myself, who I speak Spanish, and every time we have Spanish aides, I was able to help them.
That's
so
right.
it was a big challenge.
And it still is, yeah.
It still
Yeah.
is but now at least we communicate in writing in Spanish and in Russian and Chinese. All communications today go out in many different languages, including Creole.
And you know, it's funny that we're coming back to this because what Margaret referred to in her research was that communication was key in making people available for work. And so it's all connected, and you proved it with this project. I want to pull this up because I know these are some cool quotes you had, just so people can look at those. I hate to cut you short, but you know what? This has given us
That's
the flavor for maybe we can do a bigger project next year, all of us, right?
interesting. Yes.
And then I want to just show folks that you are going to get these slides and have the issue brief and all those checklists that you saw popping up. I want to do one quick poll question before I bring Kim in. So if you just go back to that app or to your text that's open, we want to know who you are. Are you Alexa? Are you a Cha? Hospice? This is primarily, I know a lot of you are combos, or are you one of our partners, like an association? A lot of Chas today, comparatively speaking. Cool. So it's going a little bit up and down, but about half Lixas. So thanks for answering. Appreciate it. And now it is my pleasure to move on from the communication C to introduce Kim Perrone. Kim is a performance coach, well-being coach, and consultant, a certified workplace mindfulness facilitator, and founder of the Center for Clarity, Compassion, and Contentment, which she calls Center 4C. Specializing in burnout recovery, stress reduction, mindfulness, and work-life balance, Kim teaches essential skills for today to support leaders, teams, and families to grow and thrive. Kim is a certified life coach with a master's degree in organizational communication. Kim has partnered in drills as well as real emergencies as a public information officer for the incident command team and as a crisis communications manager. And I'm going to add one more C and say that I am confident that she will inspire all of you.
Thank
Kim,
you, Carol.
thank you.
Well, just thank you for introducing me, Carol, and it's great to follow these ladies, Margaret, Rosa, Amanda. Thank you so much. Even more inspired. Just want to do a little bit more introduction. If you want to go forward, Carol, thanks. Previous to becoming a coach, I spent 20 plus years as a communication professional. So it was in the chemical industry that I was a public information officer, part of incident command. I was the company spokesperson, and I was on that team of, if something blew up, we would take care of it. And so during my communication time, that was somewhat central in the time period. But I worked in economic development, which was very much community outreach. After the chemical industry, where I did most of my emergency response and crisis, some time in hospitality, and now healthcare, because even during the pandemic, I was able, under a grant with HCP, to do work with mentorship. So for pilot organizations, we were talking with healthcare aides and helping create a mentorship program. So that is how I initially met New York HCP, and happy to be here today. And what I would also say is part of that, me being a coach, now dealing with individuals and organizations in well-being, my own personal tragedy happened, and it's one of the reasons I'm a coach. And it was nearly 20 years ago. I lost my son in a car accident, and blessedly my younger son survived. So as it was tragic and a blessing at the same time, and I needed to find well-being, and it was something there was my crisis and there was recovery, and it's something that went on. A few years after losing Jack, who was 9, and trying to find my way to having a good life for my just turning 8-year-old son, Stephen, we had another family crisis, which was my sister was diagnosed with cancer after she had her first baby. And this was my little sister. And within 11 months, she passed away at 34 years old. So the personal tragedies, and believe me, I will bring, I don't want to make anyone sad, but it was, professionally, I'd been the public relations person, meeting the crisis, being on the crisis team, and then personally, I was navigating through crisis and recovery at the same time. So between the years of 2004 and 2009. And today, 20 years later, from losing my son, I have to say, have really pulled it together. And Carol, you can move it forward to say now, 10 years ago, nearly 10 years ago, in 2014, kind of pulling my life's experience together to be a coach. And what did that mean? Before we were using well-being like we use now, which is so exciting. I now provide a form of coaching as employee assistance. So I appreciated the ladies mentioning employee assistance, and Amanda, you talking about that and my largest client is Hudson Headwaters Health Network in the Adirondacks. So I feel like nursing and home care and the caregiving industry and the healthcare industry is extremely appreciative of this. Like, we are having a messy human experience, and all of these things are worth talking about. And I appreciate that. So we can go forward. Now to the fun part. So when it comes to recovery, so meeting the moment with clarity in a crisis, it's just a note of caution here. First things first, we have to just know, and this is going to sound really elementary and really simple, but it's on purpose because we need simplicity, right? To endure. So this is where we can make it. Crisis moves fast. Okay. We know that, and you've experienced that, and you've lived through that. Recovery moves slow, and that's your classic tortoise and the hare right there, right? It's like, okay, we've got the speedy part of it that can be very chaotic. People had jobs, we weren't not stressed, then we're stressed with whatever the crisis is, and then recovery is, we might be worn out bunny, right? And then, but the turtle needs to continue. Slow and steady wins the race. That continued communication, continually supporting the emotional support. So as we move forward, just understanding these are natural and difficult tensions. They're natural but difficult. And the great part is we have this rubber band effect, like the resiliency. We can move the bullet forward, Carol. It's this stretched band has amazing potential, right? It's like we are pulled and stretched, and I know that you all are feeling a lot of that amazing potential. So I want to inspire you to follow some of you can move the slide, Carol. Obviously these are some normal types of crises, right? And you've lived through normal types of crises. So whatever it is for you all is something that your team can, and we can move forward, your team can work on, right? Oh, back up, Carol, for a second. Okay, so the team, working on these pieces, and I can say, whoever that is your team, who makes up your team, I want you to feel inspired to not postpone this or not push it aside, but to really think about this team, get them in a room together. And when I look back on my career, the professional crises in the chemical industry, especially, I wanted to, this is me thinking about treasured colleagues. We those are some of my fondest work memories, are connected to our connection together and preparing and having scenarios and then moving into action when we needed to. So when communication, the scenarios, preparedness, that those can be adapted very quickly in a crisis for recovery, and puzzle pieces moved. If you think through what might happen, that flexibility, collaboration, and emotional support, as we've seen from the prior presenters, very, very important. So if you move forward, Carol. So the crisis team, the recovery team, same people, yes and no. Maybe yes, maybe no. It's going to depend on what happens and in the moment that we're meeting this moment. So, sitting down ahead of time when things are calm, but, everyone's busy and work is very busy and there seems to never ending need, right? We have to carve out time. This is the real coaching part, is carving the time to sit and think clearly through these things. Who's the team? And you might have that in place already. And then, where might they overlap to be the recovery team, or where they may be different? Where and how do they prepare? What kind of meetings are they having? How often do they get together? Some of the things that are easy to maybe just build some structure around here. And what are we going to do? Anticipating, planning, having some scenarios that can be easily adapted, because ultimately that level of clarity will lead to some quicker action or endurance when it comes to recovery and the continuity of your business. So again, keeping it clear and simple and very vivid is the clarity. That team knowing that they have organizational support, those scenarios they can adapt very quickly as the event unfolds, and it may be different than we expected, but I bet a lot of the elements might be the same that we might be bringing to the table. And assigning the new members, who might they be, moving that into the system, and the communication. So important. That came up a lot. And of course, near and dear to my heart, being communication was my prior career. Now I just do individual and in group, but keep feeding that, because your crisis teams and even maybe your recovery teams can get tired and weary, right? Is it's old hat to them, but really people need that to be seen and heard and touched and interactive. Are we communicating out? And where, as we saw with the calls that were talked about earlier, it's like that inward communication as well, both directions. Where might that be applicable in some planning or recovery? And then that caring in action, what are the actions that we'll be taking, and really thinking about that ahead of time, because the connection, really all of life boils down to the connection we make. And in overall, you're in a caregiving business and an amazing profession that everyone needs, and your people and that compassion, continuing that business continuity, the world needs what you all do. So we can go forward. So again, I do like C's, as Carol said, and Carol, you're even a C, but when I started my coaching practice, I broke all kinds of rules because I was like, I'm going to call my coaching practice the Center for Clarity, Compassion, and Contentment. Well, because that's what I was feeling the world needed, but it was a little long and clumsy, and that's why I call it Center for C. But these C's matter, right? And they can help us with clarity. It's just, there's caring, communication, the connection, the compassion, and the continuity, business continuity. So this, just keeping that as simple as possible. It's the, keeping that focus and that goal to help buoy everyone in a time where people are tired and stretched like that rubber band, but also stretched like that rubber band high, the higher potential. So these C's will help you in this preparedness and preparing for what recovery looks like for different crises, it protects your company's reputation and the staff well-being. And then obviously additional resources are out there for continued well-being. You know, what does that mean as the recovery goes on? Helps us move into action quickly, keeping everyone connected and alleviating suffering. This is where that compassion comes in. We want to alleviate suffering, and we know that we don't control suffering. And so this is the theme in the sub presentations here, but it's the theme in your industry, right? The caring that home healthcare aides do. You know, you didn't create the situation, you're alleviating suffering, and you're caring and connecting with individuals. So it's a beautiful thing. And the next slide. So in the recovery, these are just some questions to ponder later. Timelines are going to vary, right? What's the aftermath? What's the resources? Number two, you know, did you cause the crisis, or are you reacting to it as you move into recovery? Okay, this may or, you know, maybe more or less relevant. I would say, you know, a big layoff causes some suffering that your employees, and then there might be some recovery, and that might be a crisis internally. Obviously, I used to work in the chemical industry, so it was like, yeah, were we reacting? Were we saying sorry for something? Sorry, we'll take care of it. And here's the communication. So that matters when you're contemplating scenarios in advance. Number three, think, what is your best? Our best is not always the same every single day. So, you know, what is the best we can bring on week 1 or 2 of recovery, and the best we can bring, you know, week 8, 9, month 3. And I see even, you know, a few of our presenting team nodding, like, yeah, the pandemic really showed that, right? You want to be compassionate to yourself too, and think, you know, we're doing our best, but the best may change as we look at the timeline. This openness and transparency of communication, where you can do that, people are so caring and understanding. They really do appreciate being communicated to. And so how does that continue? How can you make sure that really endures? You know, maybe that's a separate person who's, you know, on the team, and that's their whole job, is just writing the right communication. I'll never forget the plant manager when we had a fatality at a chemical plant. The plant manager saying to me, "Thank goodness you could write something I could not have put into words to talk to my staff, the rest of the employees." And in that moment, I had much more clarity than he did. So, you know, how that continues is going to vary too, and something to think about. You know, fostering that caring culture that you have built, so that follow-up and the appreciation and checking in, using your emotional intelligence to not be afraid of how people feel, but to actually check in and be able to listen and hold compassionate space for people's feelings. This is what I really do on a daily basis, and appreciate Ben's comment, you know, the feelings are welcome here, that Amanda had shared. And then summarizing and evaluating the response and recovery effort, you know, that's part of the communication and part of, you know, some team members' responsibility to encapsulate and capture that. And definitely recognizing the resilience, you know, where you can support, recognize, be an appreciator and not a depreciator in a time when people are rising to the challenges, is important too. And that could be tagged onto the communication person's role in that cross-functional crisis recovery team. And just know that you can move forward with much more potential, because these moments do turn into strengthening of individual resolve and organizations, and can become case studies for the future for how we deal with this. So Carol, you can move forward.
You got a lot of information in a short period of
I
time.
know. I hope I didn't talk too fast, but
No, it's great. But
I did
before
kind of land us in the right time period, right?
before I go to our contact slide for you, I just want to say that, you know, like the light bulb went on in my head so many times when we ask in these emergency management webinars, what do you need more of? Everybody says communication. And our first thought is communication about where the fire is, or communication about the weather. this is a whole nother level of communication that we're talking about here. So that's like, that has me all jazzed up. And then I want to remind all of our agencies that while some of this, the research that was presented was a very large scale agency, there are things you can do on a small scale. I know that a lot of times in an agency, there's one person wearing 8 hats. And, sometimes one phone call to one person can make as big a difference as a phone call with 100 people on it. So don't forget you can adapt. One last thing, crisis bringing us together, Kim, that was like brilliant when you talked about the chemical, when you work there and like working with your team in a crisis brings people closer together. And I think that's what I'm hoping that's what the pandemic did. And I'm sure that's what happened at VNS. Amanda alluded to that and said she and Rosa got a lot closer because of that. So now I'm going to let you go back to talking because it's your time.
Oh, well, great. You can just pull up. So there was, in addition to my contact information, and obviously if anyone's curious as to more, feel free, my contact information is there. But also we do have some time and if you have any
Yes.
questions, and then one more click, Carol, I think there's there we go. And then another click. And then, yeah, they're obviously the specific guides and help for planning, emergency preparedness, ready.gov has a lot of details for that team that you put together with some brownies and goodies. No, but just kidding. But, to forge that partnership that they have in thinking some of this through and feeling good about that and not feeling like it's hanging over your head is something to do. So with that, if anyone has any wrap-up comments, Carol, any engaging, any questions that might come in our last few minutes.
Yeah, does anybody have questions for either the VNS team or for Kim? I didn't see anything in the chat. I just clicked in there. Keeping in mind I got 3 screens going on here. Laura,
Thank you,
I
Carol.
think
You're doing good.
I think Laura's out there and she would alert
I
us. if
am,
there's-
and Carol, I do not have any questions in the chat box.
Okay. So we are going to hit one more poll question. And this is a free type, so you're going to just enter a 1-word answer. If you enter 2 words, only the first word's going to come up. So be very careful what you type. So 1-word answer, and I want to give you some suggestions. So we want to know what you want to hear about as far as future webinars. And if the topic that you want to hear more about is this one, just type the word this. So we're going to let that go for about a minute. Okay, CDPAP is a great topic, but it's not emergency management at this moment. So any emergency management topics, exercises, and I do want to put a plug in while you guys are typing that we've done so much talk about communication and getting the message out. You can go to the HCP emergency management website and there is a recorded webinar that we did a couple of months ago under the same grant that is about mass notification applications. So different agencies came on to talk about the apps that they use to notify their patients, notify their staff about different things. So a couple people participating, earthquakes, natural disasters. Preparedness. What kind of preparedness? Do we need to prepare our staff, our business, our patients? You can answer more than once, so type away.
And
I think
Carol,
that was-
as
Oh, sorry, go ahead, Margaret.
as people prepare, I just want to actually let you know, because you mentioned, yes, we're a very large organization. We do have a lot of resources, but our action checklist and our issue, the interviews that we did and well-being, we invited a lot of LICSAs, all different sizes, who contributed to the development of those action checklists. They're not VNS specific at all. So like some of the ideas are geared specifically towards smaller agencies and how to leverage connections amongst each other and leverage associations to get the resources that they need to do more pandemic preparedness. I just wanted to, point that out.
Yeah, I'm glad you did because I forgot about the checklists already. And those are a great resource. And I know you said there's one for association, so I will be doing some homework myself. And Kim, did you have one comment? I am going to close the poll because I want to put the I want to thank our speakers and my team at HCP. And here is my contact information. And we want you to fill out the evaluation where you'll have the opportunity to let us know the topics you want to hear about. And Kim, you had one more thing to add before we close, I think.
Just thought that how great the data that Margaret had was, and it did show that, you know, employees that had good well-being were, you know, better resourced to rise to the occasion, and where there was mental distress, it was a little bit below the line. So wherever that was coming from, I appreciated that well-being came up high here, and appreciate being with all of you today.
Yeah.
Thank you.
Margaret, Rosa, Amanda, anything else to add before we close and give folks back their day a minute late? Sorry.
Okay, I won't take another minute.
No, you can.
Yeah, no, that's
If
okay.
people need to
Thank
drop
you.
off, we understand. So there's one more. Okay, people are saying this. They want to hear more about this. They're putting it in the chat. Excellent. Thank you. And transportation, we have a transportation project in the works right now. So if you want to email me about how to get on board with that for next year, I would love to hear from you, Enid or anybody else. Thank you all for coming. Thank you to my speakers and have a great day.
Thank you, everybody. Have a great
Bye-bye.
day.
Thanks for
Thank
having
you.
us.
Bye.
Everyone,
Thank you.
have a great
Bye.
day.